But next to health, the role of the district nurse can be vital in rural areas as they can treat people in their own homes.
The Northumbria Healthcare Trust includes some of the more remote parts of the region. And Derek Proud has been to see the work of one of their nursing teams, which has to cover hundreds of square miles.
A misty winter morning in Bellingham in Northumberland. Picturesque, quiet, well away from the bustle of modern life. The surgery in the village is the most remote GP practice in England, serving people over an area of 800 square miles. And that makes the job of community matron Grain Rapier and her team of 10 district nurses absolutely vital.
The team look after people at home, people that can't get to a GP surgery, and that can be anything from taking a simple blood test to monitor a chronic disease that they might have. It could be a wound dressing for somebody that's been in hospital and that's been discharged, to actually a very complex assessment for somebody with multiple health needs, and working with that patient and their family to agree a plan to keep them safe and healthy at home, and hopefully avoid admissions into hospital when they don't need to go.
Today, Grain's home visit will take her up the North Tyne Valley, 17 miles away.
We're going to see Alf, who's an elderly gentleman who lives alone. He's got multiple medical problems. He is one of our patients who potentially is at risk of an avoidable hospital admission.
This is fairly typical?
Yeah, fairly typical. We'll probably see Alf sort of every few weeks. He's supported well at home with a care package, and the carers will quite often ring us if there are any problems with Alf that we need to see in between our planned visits. Hello! Brilliant.
Next time,
this is cold. It's been in the boot.
and warm your bloody hands.
Well, this is freezing. It's been in the boot.
It is keeping in touch with them, and I think one of the things that is really good is that the population isn't huge, so we tend to get to know our population very well. We know the extended families, we know the daughters, the sons, the mums, the dads, so we build up a really good relationship.
Excuse my language.
How important is it that you get these visits? How much does this help you?
It's everything, for even just blethering. That's a Scottish word for talking, like. It's much better for me. I don't have to go out.
So as long as Grain warms her hands up, you're all right?
As long as I've got warm arms, she's all right.
All right, see you later.
These are everyday visits for Grain and her team of district nurses, but they help people like Alf to keep their cherished independence. Derek Proud, ITV News.
An insight into the work of the district nurse, Grain, with warm hands, says Alf. The ITV News continues with the national and international stories at 6:30. Here's Mary Nightingale.